Hi, I'm Fran Griffin, and I'm an improvement advisor working with the New Jersey Academy of Family Physicians on their prediabetes screening program. With me today is Ed Young, the developer of the technology being used in this program. We're going to tell you a little bit about the program and how you can enroll your practice. First, as a bit of background, prediabetes is quite prevalent in the United States population. And based on estimates, there could be over 2 million people in New Jersey who have prediabetes. The challenge is that most of them don't know they have it, and many will go on to develop type 2 diabetes within 5 years without intervention. The good news is there's a very simple risk test to identify those who may be at risk. The American Diabetes Association and CDC have been using the simple test displayed here for years. It has just 7 questions that are very easily answered, such as your age, gender, weight, and a few other yes no questions. So the whole test can be completed in less than 2 minutes, and then it comes up with a numeric score. If someone scores 5 or higher, then there's a note on the test that they may be at risk for developing diabetes. And those are the people who may be pre-diabetics. So how this is used within the screening program, it ties into a program called Diabetes Prevention Program. So this is a CDC program that emerged out of a large clinical research study based solely on lifestyle changes, mainly activity and eating habits. And they found in the research study that the reduced risk of type 2 diabetes was 58% for the participants. And for those who were age 60 and older, it was 71%. So this is a very effective program that can help people reduce their risk of progressing to type 2 diabetes. New Jersey AFP and New Jersey Department of Health are working to expand offerings of this program in New Jersey. First, though, we need to find out who the people are who need to be enrolled in these programs. So here's a visual of how it works. The first step is screening all patients for prediabetes risk. That's using the test that we just showed you, which takes less than 2 minutes to complete. Of those who score a 5 or higher, those patients should then have a visit with you, either a telemedicine visit or an in-person visit, to discuss their risk of prediabetes and developing diabetes. In the pilot study we did with a couple of practices in New Jersey, that was 15% of the people who completed the screening. Only a subset of them will truly turn out to have prediabetes as diagnosed by either HbA1c or a blood glucose test. Published studies indicate that maybe up to 25% of the people who are identified at risk. And then those people ideally would be referred to a diabetes prevention program. So I'm going to turn it over to Ed at this point to talk a little bit about how the technology is helping us complete the screening.
Thank you, Fran. So we realized that we need to make this easy for patients. And so what we did was we made a simple web link that patients can access through their mobile device while they're in the office or while they're doing a telemedicine visit or while they're waiting outside in their car to see the doctor. This web link allows them on their mobile device to go and do a simple question and answer process that they are stepped through simply. And their step through process works based upon how they answered the prior question. And so instead of having to do a form and make calculations themselves, or the doctor or your staff having to make the calculations, the app itself, the website, makes the calculations and then delivers that easily to a secure, HIPAA-secured website that allows for your staff and the doctor to do the review that's necessary. We've been very careful to make sure that everything is, I say it again, HIPAA compliant. It is done in a secure environment. We contracted with a recognized HIPAA compliant email service provider. We have no access to the patient's information. It is all anonymized, and our servers do not store protected health information. We've been very careful about that and are sensitive to it, and have provided an easy means to lessen the burden on doctors, the staff, and to integrate into the workflow as seamlessly as we could achieve. Thank you, Fran.
Thanks, Ed. So if your practice is interested in enrolling, here's how it works. And essentially, we will work with your staff to promote the screening to your patients. We've got all sorts of resources that we can provide you to get it out on social media and have posters displaying it in your office. We've already got experience in incorporating this into the workflow of a practice for both in-person and telemedicine visits based on our pilot. So we'll work with your staff to ensure that this works effectively with your own workflows. And then we'll talk about how to save the scores into your EMR using an existing field so that you can use these to run reports, do outreach, and benefit from tracking this over time. So if you are interested in joining, just contact Sandy Seltzer at NJAFP. Her contact info is displayed here, and we will get you started on the program, and we look forward to working with you potentially. Thanks for taking the time to watch this video, and have a great day.